Everybody hear me? If you want to just wave, nod. Okay, thank you, thank you. Okay, we'll get started. I'm just gonna share my screen with you guys. All right. So before we get started, I just wanted to mention that this is my first time hosting through Zoom. So please be patient with me. I likely will do, if you have comments or questions, if you want to unmute yourselves and ask those at any time, please feel free. Right now, everyone's muted. Or if you have something you want to indicate through the chat box, please do that. So we will get started. My name is Mateja Savoie. For those of you who don't know me, I have worked with SNAP-Ed for several years. In the past year, now I've been working in the nutrition department teaching, but I'm still able to work with SNAP-Ed for at least 2 months a year. So that's kind of what brings me here. Heidi asked that I talk about the 2015 Dietary Guidelines and some of the changes that have been made through these recommendations. So I'm going to be talking about healthy eating patterns, and really the 2015 Dietary Guidelines really focus on healthy eating patterns now, as opposed to focusing on specific nutrients. And so I'll talk a little bit about that and really what the Dietary Guidelines mean when they're saying that we should be consuming healthy eating patterns. And I want to just mention nutritionism is a word that's not defined in the Dietary Guidelines, but I think it really aligns well with what the USDA is recommending. So that's kind of what the layout for this training will be. And again, like I said, feel free to in any way share comments or questions at any time.
Mateja, okay, I'm going to cut in.
Previous versions of the Dietary Guideline relied on evidence from relationships based on nutrients, foods, and then really how these nutrients and foods improved or changed our health outcomes. So in the past, you would see the Dietary Guidelines focusing on vitamin D, B12, vitamin C, other really specific nutrients, and they would emphasize why those nutrients are so important. So maybe they would talk about calcium for bone health. They would talk about, let me see. Like I said, I'm getting new to this, and I have one audio is cutting in and out to other people talking. Okay, let me.
Mateja, can you hear me?
Make sure everyone's on mute. Okay, hopefully that helps. Everyone should be muted. If not, please send me another chat. Okay, so again, really in the past, it's really emphasized these key nutrients and their value to decreasing chronic diseases. And I want to emphasize that it's still true, the evidence still shows that these key nutrients are vital for very specific reasons. But what the USDA is recognizing with these new guidelines is that we don't consume nutrients. Instead, we consume food, and through that, we have an eating pattern. And so this new set of dietary guidelines focuses on, instead of looking at nutrients in isolation, we're now looking at, what does an eating pattern look like, and how does an eating pattern influence health outcomes? So looking at it more as a whole instead of bits and pieces. I just wanted to tell you a little bit about how they develop these guidelines. So they look at a variety of different data and research. And these last guidelines were developed from finding all of these systematic reviews and kind of basing their recommendation on those systematic reviews. And just as a reminder, a systematic review is when you take research, everything that's been published in one specific topic, and you pull it all together, and then someone kind of pulls out highlights and themes and really what they kind of write a paper on really what all the research is saying on that topic. And so that's one thing that was used heavily when developing these guidelines, was looking at systematic reviews about healthy eating patterns. But they also use things like food modeling and analysis of current intake in the US population. And they use that by taking data from Burfus and from NHANES, which are two large-scale surveys and research that's conducted to determine dietary intake and physical activity and other smoking and other health behaviors that people do in the United States. So they basically take all of this data and they pull it together and they really look at, okay, what type of behaviors make people healthier. So really what they found is that looking at eating patterns as a whole is an indication of reducing the risk of chronic disease, and it also ensures nutrient adequacy. So really what they found is that we don't really have to focus on specific nutrients, because if we're eating an overall healthy pattern over an extended period of time, then we're really going to be naturally meeting our nutrient needs, and therefore reducing risk of all those chronic diseases that we know that are tied to those specific nutrients. So most of you are very familiar with all of these previous visual representations of the dietary guidelines. I just wanted to pull them up. This is a slide that I like to talk with my community nutrition students about, and I was just presenting this with FACS teachers a few weeks ago and had a nice discussion about this change and how we've seen changes in the dietary guidelines, and as a result, how we've seen changes in the visual representation of those guidelines. So the first one on your upper left, that's the pyramid from 1992. That's when that was developed, and as you can see, if you remember when that was being used, it was, the items at the bottom were more important and should be consumed more than the items at the top. And the bandwidth kind of also indicated importance. But people really struggled with the specifics of this pyramid. And it was really not easy for a lot of people to understand. People were unsure how to apply it to their diet, how to apply it to their own life. So then that's in 2005, there was the transition to my pyramid that you can see on the upper right-hand corner, where they kind of took out some of that extra information along the side, but really the key information was the same. They still have grains as the item that we should be consuming most of, with fruits and vegetables also very important, and then the other food groups in there as well. And again, the bandwidth represented how much of those foods, or how much of the food groups we should be consuming on our day-to-day intake. And again, this just really wasn't working well for consumers, which is why we transitioned to My Plate back in the 2010 Dietary Guidelines. And I just wanted to let you know that with the change in the 2015 guidelines, they are sticking with My Plate. So My Plate still is the visual representation that will continue to be used through the next 5 years. So what I've heard when I've talked to students and when I've talked to professionals is, for the most part, people really like My Plate. Consumers like it. They understand it. It makes sense. They feel like they can actually apply it to their meals and their menu planning. So really, just remembering that this is a really useful tool when we are emphasizing these dietary guidelines, which is what we need to do with our SNAP-Ed dollars and our time. So keeping in mind that, this won't be changing, and this still represents this healthy eating pattern that's newly emphasized in these 2015 guidelines. So I just wanted to kind of ask you why you think they changed the dietary guidelines from specific nutrient recommendations to overarching recommendations of developing healthy eating patterns. So if you want to put in your chat box some reasons why you think that this transition was made, I'll give you just a minute to do that. And it looks like everyone is indicating that they're here. So if you haven't already done that, please do that in the chat box as well, so we have an idea of all the people that were on today. So if anyone can think of maybe why we transitioned, if not, I'll be going into that, and it looks like, okay, it looks like we'll just keep going for now, and then if you have questions, just let me know. So really, when it comes to a healthy eating pattern, the reason that they changed to a healthy eating pattern is, and emphasizing that in place of nutrients, is really the idea that eating healthy over an extended period of time allows you to meet all your nutrient needs and therefore reduce the risk of chronic disease. Laurie indicates that at a glance it's easier to know what we need to have in our diets. So yeah, exactly. So if we're using My Plate as the tool and we're just thinking about healthy eating in general, then it's a lot easier to educate people about that than it is about specific nutrients. And it's also a lot easier as consumers to kind of figure that out. Another thing that I wanted to mention is that, with the dietary guidelines focusing so much on specific nutrients over the years, we have also seen that consumers have really focused in on nutrients. So if you think about really the expansion of the supplement industry over the last 10, 15, 20 years, it really kind of aligns with recommendations provided by the USDA and other agencies, because they were recommending increases, that we increase intake to meet needs of B12, to meet needs of vitamin D and calcium. And so what was happening, instead of people actually consuming those foods, is people went to really what is very easy but not always effective, and that is consuming those nutrients through supplements. And so with that, it's really important that this emphasizes the need to obtain these nutrients primarily through food. So that eating pattern is really emphasizing how we can obtain these nutrients through food instead of using supplements. So that's a new recommendation provided by the USDA. So going back to the definition of an eating pattern, these are foods foods and beverages consumed over the course of any day, week, or year. Now that's exactly what the USDA indicates in the dietary guidelines. But I argue with that a little bit because, in my opinion, what we eat in one day isn't necessarily a representation of our overall eating pattern. So people probably have had days like this where you're eating on the go and you're not eating your typical foods, and maybe you have kids sports and you're running from one to another, or you have company in town, and so everything you're eating is kind of more fun foods, more foods that we should be eating less often, but it just happened to fill up all of your day meals. So that happens, and that's why, in my opinion, an overall eating pattern shouldn't be indicated by one specific day. Because one day might look like that, but if most days look like this, if most days follow the dietary guidelines and fit in all of the food groups and highlight, increasing fruits and vegetables, then really this one day isn't going to matter in the long run. And this one day doesn't represent someone's complete eating pattern. So I just wanted to bring that up as something to think about, that really eating pattern, I look at it more as, what has someone been eating over several months? What have they been eating over several years? And I'm getting another person asking me to mute everybody, and everyone is muted unless you have unmuted yourself. If you have unmuted yourself, please, it looks like everyone's muted. So if you're having problems hearing, I apologize because I'm the only one that should be on right now. But if you are unmuted, please just mute yourself. Okay, so really thinking about that, and really what the dietary guidelines are emphasizing is that an eating pattern is more than the sum of its parts. So it's more than just the nutrients we're taking in, it's really the foods that we're eating over time. And the research also indicated that an eating pattern is more predictive of overall health status and disease risk than individual foods or nutrients. So what we do when we do research on specific nutrients is oftentimes we will have people take a supplement over a specific period of time and see how that changes blood levels and disease risk and things like that. But then other times we'll have them change their dietary intake and see how that changes those same factors. But what we're really seeing now is that, people's diets change over time. They're not eating the same foods all the time. And really looking at that overall eating pattern is a much better representation of lowering disease risk for healthy eating patterns. Now, also, an eating pattern can be adaptable. And this is something that the USDA is recognizing that hasn't always been recognized in the past, maybe only in the past 5 or 10 years, is really that we need to be able to help people adapt their eating patterns based on their taste preferences, their traditions, and their food budget. So these are things that you as educators are thinking about all the time when you're working with people. In the past, people would, dietitians would provide recommendations to clients and patients, basically telling them to eat certain foods, even if they, without even considering whether or not the patients or clients actually liked those foods. And now we're realizing that we have much greater success with increasing healthy habits if we actually understand what people like and what they don't like, and then try to help them increase fruit and vegetable intake, for example, by focusing on those fruits and vegetables that they like and trying to incorporate more of those in their diet instead of forcing them to eat Brussels sprouts or broccoli or some of those other vegetables that we know would not be successful. So traditions are also really important, and as we know, working with people on a food budget, and so understanding that how we can incorporate these dietary guidelines to help people eat healthy on a food budget. And all of you are experts in that area, so I'm not going to go any further. But I did just want to recognize that the USDA is indicating that is a key element. I indicated how nutritional needs should be met primarily through food and not through supplements. And really the goal of the new dietary guidelines is to focus on healthy eating patterns throughout the lifespan. And really with the recognizing the reduced risk of chronic disease if that happens. Now, this is a really key concept, and I know we have a lot of you that work in schools and work with children, and the research really supports how starting earlier on in life, starting those healthy eating patterns makes it really natural and makes it more of a lifestyle, just a general lifestyle habit to eat healthy through the rest of the life than it is when, we're trying to make changes with adults. It's a lot harder to make changes with adults than it is with children and youth. So the dietary guidelines are really recognizing that we do need to start early and implement these changes into diets when children are young. Okay, so I also wanted just to talk about a little more of the research that they found. So what they found was that the healthy eating patterns in general are associated with the reduced risk of all of these diseases that are listed. So cardiovascular disease, type 2 diabetes, cancer, overweight, and obesity, all of the really common diseases, those that, take up the top 5, killers in the United States, the top 5 reasons that people die, basically. And so really they're emphasizing that over time, we can reduce the risk of chronic disease just through changing diet. And one thing that I think is really interesting that I like to talk to my students about is Okinawa, Japan, which is an island off of Japan where people have historically, they've just always eaten really healthy diets. So they eat a lot of fish, it's healthy fats, They don't drink a lot of alcohol. They don't smoke. They're really, really active people. And the people in Okinawa are the healthiest people in the world, and they have the longest lives. So they have more people that are 100 years of age or older than any other place in the world. And really what they've found was that it's their lifestyle of really their healthy eating patterns and their exercise that reduces the risk of all these chronic diseases that I have up on the screen. So it's just really interesting that what an impact diet can make, as all of you know. And now we're recognizing that it's overall healthy diet and not just key nutrients. So some of you may have heard about the book In Defense of Food by Michael Pollan. It's a really interesting book. The reason I bring it up is because he talks about something in his book called nutritionism. And that's really, nutritionism is this idea that we're looking at food from the perspective of the nutrients found within it instead of looking at food as a whole. So he talks a lot about these tenets of nutritionism. And so these reasons why basically people have come to this conclusion, and really why this is, what the thought is behind this. And so one of the tenets is that nutrients are the important part of food. And that is become really kind of a key message, not just from previous versions of the dietary guidelines, but we have the supplement industry out there, we have, dietitians, and we have sports people out there, all these individuals out there who are really have been focusing on nutrients. And it's in the news and it's everywhere on the web. And so nutrients have become the value when we're talking about food. And I just wanted to go down to that last tenet because it's kind of related, where the whole point of eating is health. Now, if you're willing to type in this into the chat about what are the other reasons that we eat besides health? Really, and while you're typing that in, we have so much emphasis put on health that food has become all about consuming nutritious food. But there are so many other reasons historically that people eat. And one, Lori says it's social, yes, comfort. For another person said a social event in the United States, food, and in many other countries, food is a big part of our get-togethers with family and friends, parties. It provides us energy, right? And so it provides us with, basically what we need to sustain so we can do everything we need to do. And that's really one of the key reasons why people have eaten historically, right? When people were foraging to get food and they were hunting for everything, they didn't eat because they wanted to be healthy. Instead, they were eating because they were sustaining. And someone says, to keep me from getting morning sickness. Yes, that is also very true. Cultural identity. So you guys are bringing up connections with family and friends. A lot of great reasons why we eat. And so I just wanted to kind of bring that back to the reason why when we're talking about food, it's important to talk about food as some neutral item instead of something that is, as my third bullet point says, something that's good or bad. These foods are foods, there are foods we should be eating more of, there are foods that we should be eating less of, but really the whole point of eating isn't health. And so it's important that we bring that back, that we tie in tradition, that we tie in cultural and religious practices and other reasons why people eat when we're talking about, healthy eating patterns. So again, yes, we want everyone to be eating healthy, but we also want people to be enjoying their food. And when people stop enjoying their food, it really makes it difficult for them to continue those healthy eating patterns. So I wanted to go back to the bullet about foods being divided into good and bad nutrients. And so I want to ask you, and to put in your chat box, why is it that you think it may be harmful if we label foods as good foods and bad foods? Why is it harmful as us as educators to do that when we're talking to people? Why is it harmful as us as moms or aunts, uncles, parents of kids? So think about that for a minute, and I'll see if anyone can type any suggestions in here. Okay, I don't see anyone typing in, but I just wanted to bring to your attention the research about focusing on good and bad nutrients, good and bad foods. Oh, here are a few. So someone said that there is guilt associated with eating, and that's exactly true. If we're telling people that there are good foods and bad foods, or good nutrients and bad nutrients, when they eat those bad foods or those bad nutrients, they feel guilty. They feel bad about themselves. They take on those negative feelings and internalize them. And oftentimes it makes healthy eating a lot harder. Because what will happen is, so an example that we hear of a lot is when people go on diets and say they eat a fun food or a sometimes food, but in their mind it's bad. Once they've eaten that bad food, then they say, oh, now my diet's bad, for the whole day. And so just whatever, I'm just going to eat whatever I want for the rest of the day because I've ruined it. And that's exactly what happens. Another person indicated that, bad foods become more attractive because they're forbidden. And that's exactly true, especially with children. When we're talking about, limiting bad foods from kids, trying to keep them away from them, the more the harder we try to make these fun foods not available for kids, the more likely they are to seek them out whenever they get the opportunity. So at friends' houses or at, they'll go to the local corner store or whatever it may be. And so really, again, just emphasizing that food should be neutral, and we should have a lot of reasons why we enjoy food. Health is one of those reasons, and we can continue to pull in traditions, culture, fun into food without bringing in all of the pressure. Let's see. So I'm just reading a couple other comments from people, and it sounds like people have some really good comments. It can encourage disordered eating. That's exactly true. Whenever we're talking about labeling foods, we can be encouraging those negative feelings inside, which can make people either overeat or undereat, which is very common. Okay, another person said, if food is a part of one's culture and we say it's bad, it could bring feelings of frustration or guilt. And that's so true. We need to be very careful, especially, I know some counties work with really diverse populations. And if you're saying that, X, Y, and Z foods are bad foods, and those are foods that they've traditionally eaten with their culture for various religious reasons, then that is not only going to make them, maybe frustrated or question things, but it's also going to make it so they may not listen to you. They may not actually feel like you relate to them, that you understand them. And so it can actually make it even harder for them to kind of take your education and make changes in behavior. So thank you all for your really great comments. I really appreciate that. I wanted to bring up how it's become all about the nutrients and how nutritionism really is this true thing that's happening in the United States, especially, where we're seeing that food has become the highlights on a lot of foods are about the vitamins and minerals within them. So things are sugar-free, they're low in trans fats, they're rich in calcium and vitamin D, low in sodium. So when you look at packaging these days, it's not talking about the flavor of food, the texture, the enjoyment, it's talking about the nutrients within them. And so it's just really interesting because our consumers are getting it from all angles. They're getting this nutritionism from the foods themselves, from the companies, marketing, but then also from every other aspect. But one thing I wanted to just throw out there is that really the nutrients that are naturally high in the foods that are naturally high and all of the nutrients that are vital are never advertised. So when you go to the produce section and you pick out your produce, very rarely, is it wrapped and does it indicate that it's high in specific nutrients. Now, some of them have food labels, and I do know, for example, mushrooms often will indicate high in vitamin D on there, but again, it's not very common. So it's really interesting to look at, really, if we eat a lot of these types of foods, it doesn't matter what the box says. People know in general that fruits and vegetables are foods that we should be eating a lot of. And so we don't really have to think about the nutrients because we just know that they're there. So I wanted to bring up some of the previous dietary guidelines that have gotten really specific about nutrients. And so in 2005, the recommendations were that for people over 50 should consume vitamin B12 in its crystalline form. It talked a lot about folic acid, iron, and vitamin C for women who may become pregnant or are pregnant. And then it also talked about people that are older adults, darker skin, are exposed to insufficient UV, and the need for vitamin D, fortified foods and supplements. And really, all of these really focused on supplements. So vitamin B12 in its crystalline form, talked about folic acid in supplement form, vitamin D in supplement form. And all of them indicate, for the most part, it's saying that you could get it through food or you could get it through supplements. But you can see how it might have been confusing for consumers, or maybe easier for consumers to be like, oh, okay, well, I fit into the over 50 category, so I need to go pick up a B12 supplement. Instead of figuring out, okay, what kind of foods can I fit into my diet that are high in this nutrient? Or, is my diet overall healthy? If so, then I'm probably meeting that nutrient need. So this is kind of what I'm comparing it to when I'm talking about healthy eating patterns versus these specific nutrient intakes or nutrient recommendations. This is from the new 2015 Dietary Guidelines, and I just wanted to point out that one of the highlights of these new guidelines is focusing really on variety. So as you can see under the vegetable category, we're seeing dark greens, red and orange, legumes, etc. So with the overall healthy eating pattern, the new dietary guidelines are saying, hey, not only do people need to be eating vegetables, but they need to be eating a variety of vegetables. And if they are eating a variety, then we're getting all those essential nutrients in without having to really think too much about those nutrients. So I'll talk more specifically about the food groups and give you indications of changes that have been made. They still do cup equivalents and say, how much people should be eating for a 2,000 calorie diet. Now, that's something I don't personally use it very often because I think it's really confusing and it's hard to follow, and most people don't have time to weigh and measure their food. But just so you know, that still is part of the new guidelines. Again, the new guidelines do provide some visuals of what half a cup or a cup of fruit or vegetables or protein looks like. So if that's something that you think is helpful, that your participants might benefit from, that would be something that you could use. Again, it's more about, for most people, it's easier to look at that plate and figure out, okay, what in general does my plate look like and how does that compare to my plate, instead of focusing on, a half a cup of this, 1 cup of this, and adding it all up. Our participants are really busy. They work several jobs. You know it better than I do. And so really the educational tactics that'll work better with them. But I just wanted you to know that this exists. But really what it comes down to, like I was just mentioning, is trying to get people to eat that well-balanced diet, still using my plate as the visual representation, with the understanding that it's okay to fit in some of those fun foods. It's okay to have a day where you're like, oh my gosh, I just ate all the foods that I don't typically eat, or that are high in fat or low in the nutrients that I need. It's okay, because if a diet looks like my plate most of the time. I tell people to follow the 80-20 or 90-10 rule, where if 80 or 90% of the time you're following my plate and you're fitting in all those foods that are beneficial, then someone just drew on my screen and I'm not sure how they do that. But anyway, so I apologize, that wasn't me. So if we really focus on doing that most of the time, but still having opportunities to fit in those fun foods, then we're not experiencing that guilt or that pressure or that need to, overconsume because we're not getting, like for me, it's chocolate. Every day I eat just a little bit of chocolate, and that helps me. So I never feel like I'm making it so I can't have that. It's never something that's not available for me that I then overeat later. So just keeping that in mind when you're talking to people as well. Okay, so with the dietary guidelines, just a few recommendations that kind of highlights that they emphasized in the 100-page document. So following a healthy eating pattern, their second one was focusing on variety, nutrient density, and amount. So that's something that is also really highlighted is, if we're eating a variety of foods, then we're getting in a variety of nutrients. So the more variety that we're able to eat in the different food groups, the more diversity we get. So we know that with each type, but with each color of fruit and vegetable, they have different nutrients and phytochemicals. And so because of that, if we eat reds and greens and oranges, then we're getting all of that variety in. So just keeping that in mind and helping people incorporate, a variety, not only of fruits and vegetables, but grains as well, and proteins, and trying to fit in legumes and other sources of protein in addition to meat. So that's really what they're referring to when they talk about variety. And the thing is that can be really challenging because it's hard enough to get people to eat fruits and vegetables at all. But then, adding on, okay, now let's, get a variety of fruits and vegetables in, or a variety of whole grains in. That's, another component that people have to think about. So it can be a challenging one. Limiting calories from added sugar and saturated fats and reducing sodium. I'll talk about that more in a couple minutes. Shifting to healthier foods and beverages, and then supporting healthy eating patterns. So I'll talk more about those in the next few slides here. So this is what the USDA considers a healthy eating pattern. Fruits, vegetables, whole grains, kind of everything that was really consistent with the 2010 dietary guidelines are still in place. I put a couple stars by fruit and vegetables because these are the foods that have the most research to back up really their health components, their reasons, the reasons why they're so beneficial to a healthy eating pattern. But there's research to support all of these food groups. But a couple things that I wanted to point out with meats, they are I'll talk more about the specific in a little bit, but they do have lower intake recommendations for meats, sugar, refined grains, trans fats and saturated fats, and sodium. And I'm just, for the sake of time, I'm not going to show this YouTube video, but there are a couple of nice video clips out there of dietitians that have been in the news that have really talked about the dietary guidelines the way I'll talk about them over the next couple of slides. So if you like to show little video clips for your classes, I can make sure to get that video for you. Okay, so with fruits and vegetables, really the recommendations haven't changed. 2.5 cups vegetables, 2 cups fruit. But really what has changed was this idea that we need to be getting that variety in, to be getting all of those essential nutrients in. Now, the thing that's really interesting is that, a lot of people they know that they should be eating fruits and vegetables, but yet it's still a challenge to incorporate them into your diet. And so that's, I think, where you guys come in and providing all of these really great recipes that shows how to incorporate not only fruits and vegetables, but your recipes that I've seen have all included really a lot of variety. They've included a lot of color. And so that's really essential with these new dietary guidelines. With fruit, the focus is on whole fruit, recognizing that a lot of dried fruit and canned fruit has a lot of added sugar, and there are now recommendations specifically to reduce added sugar intake. But still recognizing that whole fruit, frozen fruit without added sugar is the best, but those other options are still good as well. With grains, they talk about, same as before, at least half your grains should be whole grains. What has changed? They now define whole grains as 16 grams of whole grain as 1 grain ounce equivalent. Now, as I mentioned, I don't personally use the ounce equivalents or that type of structure when I'm educating people about healthy eating, because I think it's a little confusing, but just in case that is something that you use, that is available now. And they do acknowledge now that whole grains vary in fiber content. So, for example, brown rice is considered a whole grain, but there's actually very little fiber in brown rice naturally than there is if you compare it to something like oatmeal. So again, another reason why we should be eating a variety of these whole grains to be getting in those nutrients that are higher in some products and then lower in others. With dairy, really not much has changed with dairy. The recommendations are the same, and those 3 cups a day with fat-free or low-fat, those are for 3 cups a day for ages 9 and up, and then the fat-free and low-fat, that's for ages 2 and up. So this isn't for young infants and toddlers, just so you know, because the recommendations do differ for that. But one thing that they are including now is that they're recommending that these low-fat dairy products that we choose are low in added sugars or have no added sugars. So what happened years ago, dairy had a big push, and when that happened, dairy really expanded, and so there became a lot more availability of different types of yogurts and different types of milks, and with that came a lot of good flavor. So it was really a lot easier to get kids to eat yogurt because it was in a tube, and to drink milk because there was chocolate or strawberry. But what they're finding now is that, consuming large amounts of those, all that added sugar really adds up. So trying to limit those types of dairy, if possible, is a recommendation in these new guidelines. They are also recommending milk and yogurt to choose more often than cheese, because cheese is higher in saturated fat. But, keeping in mind that all of these foods can fit into a healthy diet. With protein, 5.5 ounce equivalents, and they are saying now plant and animal sources. And so really recommending that people eat more from beans, legumes, nuts, and seeds, and mixing that in with fish and then animal products. And they are recommending lower intakes of processed meats and poultry. So you may have seen in the news, I don't remember if it was 6 months ago or 12 months ago, when they talked about some health risks associated with high intakes of processed meats. So the recommendations are saying let's reduce those, the processed meats, and increase the nuts, seeds, legumes, and fish. I want to talk about fat a little bit, because fat is one of the areas that's not on my plate, and that's one of the concerns that when I've talked to educators about my plate, especially since we know if you're working with teens especially, fat is like this taboo thing that especially teen girls, they think, and even women, we think that if we eat fat, we're going to get fat. And so it's something that people are always trying to reduce in their diet. So I just wanted to talk a little bit about the Dietary Guidelines recommendation for that. So they are recommending to reduce saturated fat to less than 10%, which isn't very much. If you consider a lot of people consume a 2,000 calorie diet, that's only 200 calories a day. So, kind of keeping that in mind. But then really the most important recommendation that I think related to fat is keeping trans fat intake as low as possible. So trans fat, was a man-made fat that was made because the saturated fat in margarine was found to be harmful to heart health. And so we made trans fats, and now the research actually is showing that trans fats is much more harmful than saturated fats. So another thing that's really confusing to consumers, these recommendations are changing, the research is changing, but what we do know is that it is very important to keep those trans fats as low as possible. Another really interesting thing is they no longer have a recommendation about limiting cholesterol before it was 300 milligrams per day or less. But really, when you go back in all the research and you go back in all the dietary guidelines, this recommendation of 300 milligrams of cholesterol or less has always existed, but there's actually no data to support it anywhere. So they removed that from the dietary guidelines. So, again, if you're consuming a well-balanced diet, you'll have a lower cholesterol intake. Something that I wanted to mention, when I have done some education in the community, people are always asking about coconut oil. It's a really big trend. It's really popular right now, but it has no research to back it up. So the USDA is recognizing that this is a trend that's happening, that a lot of people are going to, and people are using it not only for cooking, but they're also using it to swish in their mouth for not only dental reasons, but for other health reasons that have been told to them. And so the USDA is still saying that coconut oil is a solid fat, which means it's actually the fat with the highest amount of saturated fat within it. And because of that, it should still be limited. So if people are asking you about coconut oil, it is safe for you to say, the dietary guidelines talk about, coconut oil should be limited still at this point. And there's just, there's no research to back up consuming coconut oil for health reasons. And if you have any questions about that, I know Dr. Carrie Durwood is actually working on creating a fact sheet that talks all about coconut oil that I think might be just beneficial information for all of us to know as we're educating. So hopefully we'll get that out to you as soon as we have it. So there are a few natural sources of trans fats where some foods just have really minute amount of trans fats in them. Those do not need to be eliminated. It's just so small amounts that it's not harmful. And then we really should be encouraging the use of oils such as olive oil, canola oil. There are so many different kinds of oils out there, but I know when we're working with our population, we're trying to find the oils that are most reasonably priced, and those are usually olive and canola. So even though it's not on my plate, there are still so many functions in the body that require fat that it is still important that consumers recognize that it's not bad and it's not something that we want to completely eliminate from our diets. We just want to be cautious and looking at what types of fats and oils we're actually eating. Okay, so one thing that's also been changed is before there's actually never been a recommendation as to how much added sugar we should or should not be eating. So now they are saying that less than 10% of our calories per day should come from added sugar. And again, if we're looking at a 2,000 calorie diet, that's only 200 calories. So if you consider that added sugar is found in a lot of products, it's found in our dairy products, it's found in our cereal and our jam and everything else, then it really doesn't leave a lot of room for those fun foods. So keeping in mind that, an overall healthy eating pattern is really important. There is room for fun foods in, but again, we have to be careful about over-consuming. With the recommendation still exists about 2,300 milligrams of sodium for ages 14 and up. But again, if a person is eating, really following my plate and eating a lot of fruits and vegetables, they're likely really naturally limiting their sodium intake. So, it can be a concern, especially for people that have high blood pressure or have family history of high blood pressure. For the general population, if we do get them to make those healthy behavior changes, that will slowly just reduce naturally. So just to kind of sum up the suggestions from the USDA, eating a variety of foods from each food group, following a well-balanced diet that follows my plate, and then still finding time and finding places to incorporate fun foods into the diet so we don't overconsume and get, overconsume and have issues with disordered eating or eating disorders. So my last slide, I just had a key message that I wanted to share. So the overall message from the Michael Pollan book, In Defense of Food, is eat food, not too much, mostly plants. And really what he's referring to here is that, you know, food being foods that are actually nutritious, and, you know, he kind of calls foods things that, like Twinkies and other things, those are edible products that we should be eating less of. But eating food, not too much of it, making sure that we're eating in moderation, and eating a lot of fruits and vegetables and whole grains. So really his recommendation and with this quote aligns well with what the new 2015 dietary guidelines are all about. So that is all I had to share. Does anyone have any questions? Someone asked if I could get you the PowerPoint, and I would be happy to do that. So I can make sure, I'll get that to Jared and he'll get the PowerPoint sent out. Any other questions? Okay, well, if you do have questions that come up, please let me know, and